Covalent BTK inhibitors are landmark drugs that have revolutionized how we treat certain diseases, in particular CLL, mantle cell lymphoma, Waldenstrom's macroglobulinemia. They're incredibly effective, they're safe, you take the pill, and for most patients, they're not going to have a lot of side effects. But over time, resistance is inevitable in all of these diseases. And most commonly, at least in CLL, resistance is due to a point mutation in the BTK binding site to these covalent inhibitors. Enter the era of non-covalent BTK inhibitors. They are able to bind BTK in a unique fashion with an on-off binding that isn't reliant on the same binding site as covalent inhibitors. And we have data from the Bruin clinical trial that showed that even if you have progressed on a covalent BTK inhibitor and have developed mutations, that these drugs can be effective. So in the current era, these drugs allow a new option to continue BTK inhibition, even if you've progressed on covalent BTK inhibitors. But there's more to come. These drugs actually look to be very, very safe, and there's head-to-head trials being conducted or recently completed that we're waiting for data to read out on to tell us, are these maybe even a better BTK inhibitor than the currently available covalent class of drugs? And so we need readout from those clinical trials to come. But for the time being, it's another option for patients, it's safe, it's efficacious, and allows us to maintain BTK inhibition.